Go, Fatih.
A few moments later.
Your phone ringing. Your phone.
Hello? Oh, hello sir. Good morning. My name is Akil and I'm from your goat farm.
I'm Sarah, the DPS officer. How can I help you?
I'm having a big problem right now. One of my goats seems unwell and I'm afraid that this goat may infect my other goats.
Okay, noted. Before that, may I know the sign and symptom of the goat that are showing?
For the sign and symptom that I observed, I saw that there are a few lumps on the goat's neck and the goat also seemed to be distanced from its own herd. So I am so worried, sir, and I hope you can come to my farm as soon as possible to help me.
Okay, noted. Thank you for the report. We will send you our veterinary officer there. But before that, please isolate the infected goats from the healthy goats, yeah?
Alright, thank you, sir. I will isolate my goat right now. Bye.
A few moments later.
Assalamualaikum, I'm Dr. Atika. I'm from DBS. I received a report about a sick goat from your farm.
Waalaikumsalam, Doctor. Yes, thank you for coming to help me. So let me show you my goats that I mentioned before.
Okay, I suspect this goat has CLA, Caseous Lymphadenitis, but I need to do further diagnostic testing, so I'll take some biopsy and also fungal aspiration first.
Oh, yes, yes.
Okay, for now, I'll take the specimen to the diagnostic testing lab. But for now, I need you to isolate these goats from the other goats, and when you are handling this infected goat, please make sure you are wearing your gloves and your mask.
Alright, Doctor, I will listen to your advice and I will also isolate my goats from the other goats. Thank you, Doctor.
For the diagnostic workup, the most common and suitable method is bacterial cultivation, where we will isolate the bacteria on the blood agar. For bacterial cultivations, first we must prepare the blood agar plates. The sample, which is the abscess, will be prepared, and using the sterile swab, we will extract the abscess material on the blood agar. Ensure we must follow the proper aseptic technique along the procedure. Use the straight plate method for the inoculation procedure. After inoculation process, incubate the blood agar in the 37 degrees Celsius within the 48 hours. Check the plate's growth after 1 to 2 days of inoculations. Look for the characteristic colonies that may appear. After that, isolate the colonies to undergo the gram staining procedure. Observe the characteristic of the bacteria shape under the microscopic examination. This is the result from the bacterial isolation procedure on the blood agar. The result shows a small, pinpoint, and whitish shape of colonies with an opaque in appearance. The colonies may surrounded with the weak zone of hemolysis, which is the alpha hemolysis. This is the result from the gram staining procedure, where the bacteria show the gram-positive characteristic as well as coccobacilli, short and curved in shape and pleomorphic in appearance. Other than bacterial cultivation method, molecular and serological method also can be used for the diagnostic workup. For molecular method, polymerase chain reaction is widely used for the detection of specific DNA sequences. Targeting genes specific to the Corynebacterium pseudotuberculosis, such as phospholipase D genes, can provide a sensitive and specific diagnosis. For the serological method, there is ELISA method, where it can detect the specific antigens or the antibodies that related to the Corynebacterium pseudotuberculosis. Other than that, Western blotting also can be used, where it involves the separation of the protein, then keep following by their transfer to a membrane and detection with the specific antibody. And the last method is the immunofluorescence, where it involves the use of the fluorescently labeled antibodies to detect the presence of the specific antigens. It is a sensitive method for visualizing the bacteria in the clinical sample.
The pathogenesis of Caseous lymphadenitis. The CLA is a chronic granulomatous disease characterized by the formation of abscess at the superficial lymph node and internal organ by Jeremy 2013. The infection begins with the entry of the bacterium through the skin lesions generated during handling of sheaths, wounds, or even liquid dispersed. The bacteria phagocytized by the macrophage are recruited to the site of infection, evade the mechanism of elimination pathogens presented by the macrophage. Also, the PLD phospholipase exotoxin released by the bacteria hydrolysis and cause cell lysis, increasing vascular permeability with the consequence of formation edema. The action of this toxin facilitates the colonization, regional and systemic spread of the bacteria, with the generation of abscess in the lymph node. Primary infection, the site of entry of the bacterium, with the hematogenous and lymphatic spread forming abscesses in the lymph node closest to the site of infection. Corynebacterium pseudotuberculosis is released from the inside the cells as a result of a process that leads to the death of the phagocyte. The bacteria not controlled by the abscess wall enter the capillaries and form colonies that occlude the blood vessels, generating ischemia. Together with the toxins, they destroy the cells of healthy tissue and increase the necrotic mass. This is the histology appearance inside the granulomatous pus of the lymph node. Also, the morphological appearance of abscess nodes is a characteristic of onion layer as they present a distribution in fibrous concentric layers separated by caseous material. In goats or sheep, the affected nodes are usually form a dry uniform purulent paste. The following. The viable bacteria spread to the lymphatic vessels and penetrate other lymph node and blood vessels, reaching different organs where abscess formation is repeated. These originate the clinical manifestation and the visceral type of the disease, which affect the regional lymph node and organs, especially the organs of lungs and liver. So these are the lesions generated by the CLA, or the morphologic appearance on the organs and lesions affected. So these are the lesions generated by the CLA. Over the time, if chronic condition persistent, infected cell, especially the lymph nodes, undergo necrosis, bursting and causing septicemia. Later, the body cannot compensate or even fight the persistent infection in the body and eventually lead to the death of the animal.
2 weeks later.
So how was the laboratory result, doctor?
Okay, the lab results said that it is indeed CLA, Caseous lymphadenitis.
Can my goat recover or my goat die, doctor?
There are treatments that you can do for your goats. Firstly, you need to isolate the goats that was infected. And secondly, we will prescribe antibiotics. And thirdly, we will do abscess drainage. And lastly is the goat that were infected. You need to be disinfected and then sanitized.
Okay, thank you, doctor.